Okay, so this is the last part. Okay, so we call it substance abuse. Okay, substance abuse. Okay, so this is the chapter 18. So don't worry, because after this lecture for the chapter 18 or PowerPoint number 5, we will go over again to the material. Okay, we have to make sure that we cover the what? We cover the syllabus. Okay, so substance abuse. What is your, okay, when it says that substance abuse, what does it mean? Substance abuse.
Drugs, alcohol.
Drugs, alcohol. Yeah,
Smoking.
very good. Okay, drugs, alcohol, right? Okay. And then you abuse it, meaning to say you abuse, right? And of course, when you say substance abuse, periodic forceful use of a substance that leads to clinically significant impairment. Okay? So the danger side of the word abuse is the word addiction. Okay? Because when you say addict meaning to say you are hooked on that particular activity, right? Drug addict, you know, alcohol, okay, or whatever, addict. Symptoms of, meaning to say compulsive use, okay, compulsive use. You cannot what? You cannot discontinue. You are hooked already, addict or dependent. Okay, and then of course we have also, we call it illicit substances, any chemical that alters biological function and it's not required for health maintenance. As a psych nurse, if you interested for the psych, technically the substance, or we call detoxification. Can you write it down? Detox unit is a separate unit. Okay? Again, in the psych, it's not only a one unit. Like in MedSearch, only a one unit, right? So there is another what? Another like a chain of a site. Okay? So the site can be what? Can be at, you are in the detoxification unit, or you will be in the DD, developmental disability unit. Okay? So that is a chain of a psych, right? A psych unit, not only one unit. Okay? So the next one, screening. So screening, of course, there is a detoxification unit. So everybody, of course, like acute admission, obviously either a drug abuse or addict or an alcohol abuse addict. Okay, I don't want to use an addict because it's negative, right? But dependence. So now, so whatever it is still, we cannot pinpoint our what? Our fingers and say you are an addict, you are a drug addict, you are an alcohol addict. It's still in the nursing side, what to do? We have to use an assessment. We have to use a screening. So where to get the screening? It's a what? It's a built-in from the company or the hospital or a long-term care or any healthcare facility. All you have to do is follow the facility protocol. That's it. Okay, are we good? Okay, next one. Cage. Okay, so we have a cage, but in our clinical, I have a lot of what? I have a lot of scenario like anxiety. I think I think I have a alcohol withdrawal patient. Now, so once we prove or we assess that this patient is what? Is positive for a drug abuse and alcohol abuse screening. Of course, we have to admit the patient. Okay? Are you following me? Yes or no? Now, the problem or the danger sign of what? The dangerous scenario for a drug and alcohol is the word withdrawal. Write it down. withdrawal. Okay? So, and usually, if they are not in the detox scenario, okay, detoxification. For example, in hospital, there is no detox. We will place them in a medical surgical site. So why we need to place the patient in a medical surgical site? MS site. Why? If we don't have a detox unit. Why? Why that is the second option? Why? Because of what?
Kind of crisis, like
because we have to deal with the other comorbidity. We have to check for the liver, right? Usually liver is affected. Liver. We have to check for any other comorbidity that what? That cause from what? From addiction. Are you following me? Yes or no? Again, there's another story because I love to watch from YouTube. There's another story right now that a patient, an actor, a famous actor from the Philippines that suffer from liver cirrhosis. And then he told in the interview that, oh, you know what, why I have a liver cirrhosis? I'm not an alcohol or an alcohol addict. Okay? But if you will go to the history, he is a drug addict. He is not an alcohol, but he is a drug addict. Okay? So, liver cirrhosis. Liver cirrhosis, right now he's suffering from a liver cirrhosis. Okay? So, the next one. What are the theories under the abuse or the substance abuse? We have, of course, a biological model. It can be what? According to the biological model, maybe from genetic. Maybe your father, right, is what? Is an alcohol, okay, alcohol abuse or whatever. But I don't believe on this one. Okay, biological model. Psychological theory. Okay, maybe from what? From your experiences. Okay, maybe a analysis, a behavior, a cognition, or maybe from what? Psychological theory, or maybe from socio-cultural factor, like your attitude, like what? Like your values, or like your environment. Okay? Regarding from the theory, or from your experiences. Are you depressed, anxious, or whatever? Okay? So now, let's go back to the word impairment. Okay? So when you say, what are the signs and symptoms of impairment? Maybe from family. Okay? The patient is coming from what? A violence, separation, divorce, or they have a financial problem. Okay? Disintegration of social life, isolation, or physical and mental changes, or any impairment. But as I told you before, for me, it's very simple. If you have ineffective coping mechanism, okay, from this one, for example, your parents are divorced and you cannot accept that, okay, what will happen to you? You will have an ineffective coping mechanism. Okay, you will be depressed, you will be anxious, maybe you will be what? You will try new activities like alcohol or drugs. Okay, so that's it. You don't need to explain furthermore that, okay, why, what are the drug abuse signs and symptoms? Okay, so clear for everybody. So that will be a what? An ineffective coping mechanism. Life is very unpredictable, right? Every day is a challenge. Every day, challenge. Okay, so every day you're dealing with what? With a lot of challenges. Work, school, family, any relationship, so on and so forth. Okay, but all you have to do, you have to deal with it. Effective coping mechanism. Okay, next. Here are the 11 common drug abuse signs and symptoms. So number 1, isolation. Number 2, of course, is spending time with new friends or new activities. Okay? Either drinking or using, of course, illicit drug. Never having money and always asking to borrow. Okay? Borrowing money, even for small items. Okay? That's another signs and symptoms. Showing up too late to work or showing not at all. There's something wrong. Doing little to find a job if out of work. Losing a job. Paying no attention to basic hygiene. Okay, this is another what? Common signs and symptoms. Private. Often is sleeping or claiming to be ill. Lying about using or drinking. And sneaking away to get high or drunk. Okay, take note for the following signs and symptoms. Now, health professional and substance abuse. So again, the substance abuse in general is this one. Okay? Okay, this one. God bless you.
Sorry.
Okay?
Thank you.
So meaning to say it affects everything. Money, attitude, work, performance. That is a signs and symptoms that there's something wrong with what? With the person. So again, what to do? Report it. Okay? Any suspected substance abuse user or alcohol, we can report to the hotline. Okay? Report to the hotline. And then, of course, what are the kinds of substance abuse? Okay, substance, alcohol, nicotine, caffeine, even the coffee. Coffee. Okay, coffee. But at least the coffee is light, right? Coffee is light. And of course, even the Coke too. Coke, the Coke. That's why I remove the Coke 100% already. It's very hard for me before because the Coke is helping me to be alert and oriented. Okay, because before the COVID-19 years ago, I'm from one place to another. I'm going to Oak Brook, after the Oak Brook, going back to downtown Chicago, and then after that, go to the Lincoln Avenue. Very what? I need to be alert and oriented times 3 to 5. Okay? Coke is very effective. But even you will what? You will stop the Coke abruptly. You will have a withdrawal signs and symptoms. Even the coffee. Okay, next. Another substance of abuse are the opioid. Okay, in long-term care, there's a lot of what? Elderly will ask you and trick you. Mr. James, Nurse James, can you please give me another what? Another Vicodin. You have to check the chart, Mr. James. Don't just give because of what? The opioid. Even your co-nurses, narcotic. Okay? Narcotic. Even your co-nurses, check the opioid number. Because before, when I was a supervisor in the LTC before, long time, maybe 10 years ago, you know, there's a rumor for one of my colleagues, and she is the ADON. But I don't, you know, I'm not, I don't like gossip. That's why I don't care. So, but one time, she asked me to sign something. Because if the person is good to me, why I will what? Why I will listen to the gossip, right? So that person asked me to sign like a 3 pieces of Vicodin or narcotic, I think an Ativan. She wants me to wasted to sign it. So since I'm hearing like, like a rumor, I didn't sign, right? Because that will be a signs and symptoms. So be careful. Okay, be careful. You can lose your license if you will not what? If you will not be careful in the opioids. Another technique, right? I didn't sign because I'm hearing what? A rumor or a gossip. Okay? Oh, I don't know. I'm only here Saturday, Sunday. You know, I don't know about that. Okay? So the next one. The next one, another thing is do not give your password. Sometimes in what? In the medication room. Sometimes, you know, you're trying to be nice to everybody, especially your CNA. But one time, I'm inside waiting for the next shift. I'm inside in the medication room. And then somebody opened the medication room. I was very shocked, okay? Because the one who opened is the CNA.
Wow.
And then I just asked my coworker, you know, because that time I'm very young, I'm very new, you know, I'm new nurse. So I asked, oh, you know what? You know, we are not allowed to give the password, right, to the CNA. So just like an innocent question.
Mm.
And then I think my co-nurse.
You have to report that? Then?
Yeah, you have to report. You
Yeah.
have to, what? Because if you lose some narcotic, it's in your, you will be in trouble, especially in your shift.
Right? Yeah.
Yeah. Okay. But on that time, she is very angry with me, the CNA, talking to me, oh, plastic, blah, 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 blah. I don't care because I know that I need to report that one.
Yeah.
Okay. Okay. I don't care what you are talking about, but the point is I need to report to the DON that, you know, we have to change the password. And she needs to send a memo that, you know, the nurses cannot share any password. I'm telling you. Okay. So again, please follow that protocol. Okay. So again, in alcohol or detoxification, this is a special unit, my dear. Okay, actually, I don't want to dig this one because this is a special unit. It's not really a special unit. Okay, the long-term goal of the treatment, of course, is the word recovery. That's why we call it rehabilitation, right? Because, of course, the long-term goal of the treatment is the word abstinence or reduction from the use. That's it. And then, of course, the patient will go back to the what? To the normal activities of daily living. And of course, improving of psychological and social function. Okay, next. Again, so the focus of what? Of the detoxification or what? The rehab is what? Is to go back to the normal thing. Like from COVID-19, what is our goal? To go back to the normal, right? Go back to the normal. And that's the end of the first one. Okay, can you please go over again 2 minutes? 2 minutes. I'll give you 2 minutes to go over. Okay, so are we good? Again, the detoxification or alcohol or drug abuse is special unit. Okay, and usually it's not in the long term. It's not in the long term because 90% you will work in the long term anyway. for the LPN. Okay? So 90%, again, it's up to you. If you want to work in the home health, if you want to work in the assisted living or outpatient, right? If you know somebody in a Cook County, you can work as an LPN or in veterans. You know, I know somebody, veterans outpatient, 80,000. 80,000 in a year LPN. Okay, what she's doing is like a health teaching. Okay, so let's move on. Eating this. Sure. Yeah, it's true. For LPN, yeah, maybe a little bit low. Maybe $10. $10 low. It's still a lot. I'm telling you, don't think that you are what? If I came in America 45 years old or 50 years old, I will not go to RN. I will go to LPN 1 year, and then I will save money. Okay, my remaining, 50, 60, 65, 15 years. So I will use that one to save money. Because LPN is a good career. It's only a year. It's 1 year. That's why I'm telling to everybody that you are lucky, because in America, we have a program like an LPN. Because BSN is a lot. And especially before, long time ago, it's very hard to admit in the community college. You will go to the community college, you spend your what? Your long time. Okay, long time. You will go there for 3 years, and then they will not admit you in what? In the program. Okay, that's why I'm telling to my CNA, why don't you go to the private school? Okay, because so that you will finish. Okay, and then here, the 1 year program is, I'm telling you, this, even you will not continue with BSN, it doesn't matter. Of course, I want you to be continue with ADN or whatever, but this program is what? It's okay. $30, sometimes $35. How much is in the home health, the visit? How much, Mr. Jan? How much are you paying for the visit, or Charmaine? Because they have a home health.
$60 per visit.
Oh, $60 for RN or LPN?
For RN.
How about for LPN?
$45 a visit.
Okay, 45 is it's still a lot of money.
Yeah.
Still a lot of money. Right? But again, my technique is like this. 3 days, you have to have like a 3 days, 12, 12, 12. Okay?
But I think you need to work and have the experience before you do that. I mean, I think you need to work and have experience before you can go for home health.
No, I mean, home health is pretty basic. I honestly think that hospital or nursing homes will be more challenging than home health. Home health, you just have to make sure that you're okay with going into different neighborhoods, because, you're taking care of patients who cannot afford. So some might live in good neighborhoods, some might live in bad neighborhoods, but it's just basically knowing where to go and then having good bedside manners and helping the patient out a little more than in a nursing home and in a hospital.
Yeah. But sometimes if you are lucky, like what happened to me in one home health, they gave me 2 buildings. So in one building, I have a 10 patient. In one assisted living. In the other building, I have a 5 patient. So one building, So it depends. Sometimes you have to talk to them that, you know what, I want like a building. Okay? Like a building. They will give you a building. Yeah, if they have it, building. So you will be the primary nurse. But again, it's a lot. I'm telling you, $45. Oh my goodness. But another technique, you need to have like a what? Like a 3 days or a 4 days permanent job. Okay, to pay the bills in America. And then the remaining, so is what? Home health or another part-time to, to buy a Louis Vuitton right via Dira. Okay. So, so I'm telling you, it's a motivation, right? It's a motivation. Okay. Actually, I'm very happy yesterday because I have a student before in my review in US Nursing Review Center. She passed. She's an RN. She's a 50 years old. Okay, she passed. And then after that, we became, close. And then she told me about her daughter. Okay, about like a problem with her daughter that until now, 27 years old, not don't have a career, going back and forth to the community college. So I told her, okay, let me accompany her in one LPN school that I am connected before. Okay? So 2000, I think 2019, I accompany her daughter. And then yesterday, she passed the NCLEX, LPN. I'm very happy because at least, good deed. I don't need to give a money to, to everybody, but at least I guided somebody to have a good, direction. Okay, especially the teenager right now. Okay, so that's good.
Good job.
1 year, right? Thank you. Okay, at least I did something, right? Okay, so the next one. So at least 1 year in the making. Imagine 2019. I remember that we met in one restaurant because I told her, okay, so you have to be serious. I will guide you, but make sure you have to be serious. And I'm telling you, she is my student in one subject, MS. I failed her. I gave her what? I gave her because she didn't study. I failed her. I'm telling you, personally, I failed her. I told her, oh, I need to fail you. Okay, because you are not what? You are not serious. You are thinking that I'm your teacher, and then you can what? You can be relaxed. Yeah. I personally failed her to teach her a lesson. Okay, so right now I'm very happy, but we have a good relationship. She's not mad at me. She attended my review actually. I told her that I need to give you a lesson because life is unpredictable. You have to be serious. Okay? So, okay, moving forward. Eating disorder. So, eating disorder, again, mortality is very high. And suicide is also a risk, right? So, the other comorbidity why you are dealing with the eating disorder, number 1 is depression, personality disorder, and of course, substance abuse. Okay, and of course, anxiety. So the number 1 eating disorder is anorexia nervosa. Actually, there's a 2. Write it down. Anorexia nervosa and bulimia. Okay, anorexia nervosa and bulimia. Okay, there's a 2. The anorexia nervosa is very, very skinny. Actually, I observed one in Las Vegas. Very, very skinny, like a skeleton. Okay, skeleton, right? Oh my God, this is anorexic, right? Okay, so skinny like a skeleton. So fear of gaining weight or becoming fat. Even the drop of, juice or even one piece of, food or whatever, they are thinking that, oh my God, I will become fat. All right? So the next one, another thing, anything dealing with an eating disorder, they have another psychiatric problem. Okay? Psychological. Not only in eating, also in the what? Psychological. Okay? Just to let you know. And then also their characteristic, they are preoccupied with food and the rituals of eating. But for the anorexia nervosa, they are very fear in gaining weight. Okay? Just to let you know, FYI. So there are two types of anorexia nervosa. Restricting type, loses weight by severely limiting the amount of food consumed, and the binge eating. Okay? But usually, the common type or the popular type of anorexia is the restricting type. Because usually the binge eating is for the bulimia. Meaning to say, they will eat and then they will what? They will go to the bathroom and they need to what? They need to, what's that?
Throw up.
Throw up. Okay, very good. Okay? So, again, anorexia nervosa, the common type, is the restricting type. The other one, this one is common in bulimia. Okay, but another type of anorexia, but more common on the bulimia. Okay, so are we good? That's it. End of the story. The number 2 eating disorder is the bulimia. Bulimia are thinking a lot of food. I want to eat this one. I want to eat that one. Eating everything. Okay? So in a short period of time, thinking about the food. But the characteristic is the client wants to maintain a weight within the normal range. So they are eating a lot, but they want to be slim. Okay? What they will do is they will go to the bathroom and they will what? They will throw up. Okay? So,
Miss Mary Jane,
Go
what
ahead.
if they want to eat persistently, like the way we're saying, but doesn't want to remain the same weight? It just happens where they just vomit, not because they're making themselves, but because they already have the overflow of food and they can't control it. Would that still be considered bulimia?
Again,
like
before, of course,
Yeah.
the diagnose is a diagnose. So
Okay.
before they will diagnose as anorexia nervosa, as a bulimia, before they will go on that stage, of course, there's a lot of assessment.
Okay.
Okay, but it will happen like me. It happened to me one time because I'm a diabetic, so I want a different food. You know, sometimes I don't like, you know, like a food that okay, I feel, you know, I want to vomit too. Okay, but I don't consider myself as what I have anorexia or bulimia. If this happened 1 to 2 times, that's another story.
Overeating.
Okay, or overeating, right?
Yeah.
So it happened. Before you will go on that stage, of course, you undergo an assessment. Okay, so there is like an assessment, questionnaire, everything. Okay, of course, weight, we have to deal with the weight, so on and so forth. Okay, are we good? Okay, next type of anorexia nervosa, of course, as I told you, this is a repetition, the purging and the non-purging. Okay? So again, write it down for the 2. What to do? What to do? How you will deal with the 2. Of course, the signs and symptoms that this is anorexia nervosa is, of course, the weight. Very skinny, like a skeleton. The other one, it maintains a normal weight, right? The bulimia. Now, what to do with the 2? What is the intervention? Number 1, write it down. Okay, it's not from here. So number 1 is you have to what? You have to present, you have to present the food in a very attractive way. Number 1. Okay, especially for the anorexia. For example, macaroni and cheese. I'm a Filipina. I will not eat a macaroni and cheese, but I'm buying a macaroni and cheese because of the presentation. Okay, because of a lot of cheese, so on and so forth. But if you will give me a pancit, I will eat right away, right? Okay, so you have to present in a very attractive way. Number 1, or colorful way. Number 2, after eating, right? After eating, you have to be with your patient for 30 minutes to an hour because they will go to the bathroom and they will, throw up.
So this is for bulimia?
For both.
For both, yeah.
For both. I'm talking for both. Okay? Because the eating disorder, we have 2 types, bulimia and anorexia. Okay? That's why I'm just I don't want to follow this one because this one is a little bit complicated. Okay? That's it. And then, at the same time, we have to weigh the patient. Okay? Daily weight. Okay? Because their problem is what? The problem is eating. So we have to weigh them. Okay? Or follow the order. Again, it should be coming from the order. We cannot weigh the patient because we want to do it. No, it should be the order. We cannot weigh the patient in the nursing home every day. Okay? So we cannot. It should be, there is an order. Why? Okay, are we good? Yes or no? Okay, now additional information for what? For the 2, bulimia and anorexia, as I told you, mental status. Okay, their mental status is considered distorted already. Okay, personal thinking, as I told you, just the same in the site. The way they think, the way they talk, and of course, present themselves. But the very important at the end of the day is the weight. Weight for both anorexia and bulimia. That's it. Okay, now, another what? Another information. This is a picture of what? Obviously, anorexia nervosa. I told you I saw in what? In the last, a very skin. In Las Vegas. But she's very, you know what? She's very pretty because of what? She is what? Head to toe. You know, she is wearing a nice dress, a nice bag, but very, very skinny, like a skeleton. Okay? So, of course, expected by finding, we have to check everything. Head, neck, mouth, throat, cardiovascular, musculoskeletal, you know, reproductive, psychosocial, everything. We need to follow the head-to-toe assessment. Okay? So, that's it. That is for anorexia. Okay?
Miss
And then
Mary
the
Jane.
bulimia, go ahead.
Would it be like, how do I say it? Would it be like inappropriate to like contact the family to see, because you were saying like the mac and cheese, you like mac and cheese because it's appealing to you. Would it be like inappropriate to call family to have them choose like their meals ahead of time, or have them like suggest what kind of meals they like? Like we have some patients that do not, I don't want to say do not verbalize, but like if you don't speak the same language, we had a patient who doesn't speak English. So family members picked her meals out for her.
Yeah, that's fine. That's fine.
And then we have another patient who he's declining, but he's not eating at all anymore, and the most he eats is like hot dogs and stuff like that. And I know some facilities like they don't do that, but I don't know how, if family can provide that or put a note for that. I don't know how.
Oh, that will be an internal.
Okay.
Internal, because sometimes, you know, for example, I'm the administrator of the long-term care, you know, safety is my priority.
Right.
Of course, if the family is the one who will bring the, you know, the food at all times, of course, in the business side, we're losing like every day, you know, for the meals, you know, and another one is the safety. It's the safety. Okay, it's an internal, I think it's an internal discussion between the family and the facility, because and then we have to document. If not, of course, if the facility can provide, why not? Okay, that's why there's a menu.
Is there a liability though?
Yeah,
that's what I was wondering. Like
safety. If I'm the administrator, I will not allow that, because that is a safety issue. Actually, there's a one I think she is an Indian, but she is very close to me. You know, all the time she knows me, that you know, the teacher that, you know, she will come to me. Nobody gave me a shower. Okay, that's why I will call my CNA student before, and then, can you please give her a shower? And then one time she told me, I will transfer to another facility because they are not providing my Indian food, the biryani rice. Okay. So it depends. So maybe some facility can provide and some facility cannot. Right? Because again, the Indian food is another what? You know,
specific meal that.
Yeah, it's another meal. And if I'm a Filipina, I cannot cook. If I'm the cook Filipina, I cannot cook biryani. I don't know how to do that. Right?
Yeah, because I know some facilities, you know, they're like Medicare, Medicaid, and they don't provide, like you said, they don't provide meals like that. I mean, fortunately, where I work, they have restaurant upstairs, and you know, so they can provide him with meals.
So would there be a consent from the family that they're allowed to give them food?
I know, like
document.
in his chart, he has like it's called the Grafton, the restaurant. He can order from the Grafton if he wants to. But
Mhm.
yeah,
Nice.
he's not. Yeah, he's not into the meals anymore. It doesn't seem appealing to him. So we try to give him things that appeal to him that he would, pick at or eat at, rather than giving him the meal of the day.
Oh,
Mm.
interesting.
That's
So
good. Mm-mm.
yeah,
But
that's
again,
what
it's an internal. It's an internal.
yeah.
Because unless we have like a 50 patient, Indian patient, of course we can provide a unit. And
Yeah,
if I'm the administrator, we can hire like an, like a
that
cook,
type
an
of
Indian
meals.
cook,
Yeah.
that will cook like an Indian meal, or a Japanese. You need to be an expert. That's why I support online business, but I mean, for the Japanese thing, I'm very careful.
Mm-hmm.
Because if you are not
Wow.
like a Japanese cook, right? So you will have a signs and symptoms of abdominal pain,
Yeah.
right? Yeah. So you have to be an expert for the, Japanese cuisine, So that's why you have to go with the restaurant with a Japanese cook. Mhm. Okay. So anyway, moving
Talking about
forward.
food now.
Okay, right?
Yeah.
What's that?
Talking about food now.
Yeah, the food, right? Okay, next one. Chapter 20. We're done with, of course, anorexia and then the bulimia, eating disorder. Actually, this PowerPoint is like a miscellaneous in the site. We're done with the site.
Mhm.
This is like a miscellaneous, okay? So the other one is the somatic symptom and related disorder. Okay. When you say somatic, you are depressed, you are anxious. So what will happen to you? You cannot express yourself. So you will convert it to what? To the physical symptoms. That's why after college, after my first course, I'm having like an abdominal pain. 3 hospital in the Philippines. My mother accompanied me 3 hospital. They cannot find what's going on with me. And then we go back to my like a childhood doctor, and then uh, she told me that maybe you're thinking something. Do you have any problem? Why you have an abdominal pain? She told me about that. Okay? Because sometimes if you're thinking, if you are anxious of something, we call it somatic symptom or related disorder. Meaning to say, you will convert your anxiety, your problem, your depression to what? To a physical symptoms. Sometimes you will what? You will be paralyzed. Okay? You will have a what? Acute what? Acute something. That's why we call it pretenditis. Pretension. Okay? Pretenditis meaning to say a pretension. Okay? Or it can be something. Okay? So number 1, somatic symptom disorder. Somatization is the expression of psychological stress through physical symptoms. So there's a lot of types of that. So we have hypochondriasis, we have conversion disorder, but at the end of the day, you are trying to what? You are like, you are depressed, anxious, and then you convert in the physical symptom. Okay, number 1, letter A.
Miss
Type.
Mary Jane,
Go ahead.
would that show up more in like adolescent, late teens, or any age really?
Any age, any age.
Yeah.
But
'Cause
sometimes,
I see that more. I see that more in kids.
more in kids, right? Yeah. So
My stomach hurts and they have a test or something.
yeah, yeah, you're right. And especially also for the adolescents, because adolescents, they have like I cannot explain. In the growth and development, they have like a hormone. Okay, they undergoing something. Okay, part of the scenario. It's a lot of factors, not
Yeah.
only a disorder. Okay, but it can happen also in adults.
Okay.
Can happen also in adult or in any age. Okay, so letter A, write it down, is the conversion disorder. So also known as a functional neuro disorder. So it's in your thinking. Maybe I am sick I have this, I have that, my stomach hurts, but this is a conversion disorder. So you are anxious technically, but you will convert into a physical signs and symptoms: headache, abdominal pain, everything. Okay? And then next one is the pocket use disorder. So this is a conscious decision by the client to report physical or psychological manifestation. So meaning to say, the patient will go to the doctor and report what's going on with the physical or psychological. But actually, the reality is what? The reality is what's going on. They are anxious or depressed of something. Okay? Actually, there's another one, hypochondriasis, there's a lot. Sometimes there's another one that they will go to the Walgreens, CVS Pharmacy, they are thinking they are sick, they will take everything, Tylenol, all the over-the-counter medication, from the Walgreens and what? And CVS. Okay? They are thinking they are sick. And sometimes there's a kind that they feel that they are dirty. Okay? Too much. They are anxious, they are feel that what? They are harboring diseases. So that's another what? Types of somatic disorder. Okay? That's it. End of the story. This is like a miscellaneous. Next one. So grieving. Dabda. I'll give you the answer. Care of clients who are dying or grieving. Okay, you're right, Mr. B. If you want to go to the hospice, okay, so you have to know the 7 stages of grief. This is a favorite in your ATI and NCLEX. Okay, number 1, write it down, denial. I call it dabda. Okay, it's not true. It's not true. Okay, this is not true. And then followed by letter D, right? Dabda. D, denial. A, you will be anger. Okay, anger and prostrated. Okay, prostration leads to anger. So this is the time to release a bottle of emotion. You will cry. You may ask why me, or try to what? Try to be very, very angry. Anger. After that one, anger, bargaining, D-A-B. Okay, D, denial. A, anger. And then followed by bargaining. Lord, right? If what? Give me another chance. I'll be very, very nice to everybody. Okay? Or I will help everybody. Bargaining. Okay? And then followed by bargaining, depression. And then after depression is acceptance. Again, you don't need to memorize. D, denial. A, anger. B, bargaining. D, depression. And A, acceptance. Again, it's up to you. Maybe you are in the depression stage already, but all of a sudden you will go to the denial. It depends of your what? Depends mechanism. Okay? That's why it depends. Maybe you are what? In acceptance. All you have to do, you will go back to the anger, you will go to denial, and you will start over. So it depends on your what? On your coping mechanism. Everything is in the coping mechanism. Okay, you can use the word empathy. Very important, empathy. Empathy is you are placing yourself in one's what? In one's scenario. Okay? So empathy, I try to understand what it must be like for the person. Not sympathy, empathy inside. No judgment, non-judgmental. Okay? And then, of course, boundary in the side. So in any relationship, I'm telling you, boundary is very important. Even to a best friend, I think I call it respect. Boundary and respect. Even to a sister, even to a brother. Because, for example, sister, you are what? When you talk, you are screaming at each other. It's not good, right? Sometimes you have to what? You have to show even to your sister or to your brother that you are respecting them. Okay? So, boundary and of course, respect. Okay, next. That's it. That's the end for the grieving. Again, what are the grieving stages? Dabda. Okay, dabda. What is dabda, Mr. Alvaro?
Denial, anger, what's the name?
Bargaining,
Bargaining,
depression, and acceptance.
Depression.
And acceptance.
And acceptance.
acceptance, the last one.
Mhm. Okay, that's good. End of the story. Okay? So the next one, this is a miscellaneous. Mental health issue of children and adolescents, chapter 28. Again, this is a special unit again, right? For the adolescents. But again, for this scenario, of course, adolescents needs, we have to be careful, okay, for this scenario. Actually, in the psych, for sure, LPN, you know, what company are here for children and adolescents? Only the heart group, but that is a hospital. Okay? So for this one needs an special care and attention. Okay, next, crisis management. How to deal with the crisis management? Anyway, when you say crisis management, what does it mean? Anybody from you? Crisis management. Again, if you want to be a psych nurse, you have to get a certificate, CPI. We call it CPI, Crisis Management Certificate. Okay? So what does it mean? They will teach you how to what? How to deal with a crisis. Okay? For example, the psych nurse want to what? Want to is screaming at you. The psych patient is what? Pulling your hair. What will you do? But you need to be what? You need to undergo. I cannot teach you what to do. If somebody is pulling your hair, you know, I don't want to teach what to do. Okay? You have to go to the certification. Okay? So, crisis management. All right. Next, suicide. Okay, suicide. How to report this? Again, report any suicide. Okay, write it down. All the psych scenario, all the psych disorder, anxiety, depression, bipolar, you have to what? They have a suicide ideation. So meaning to say, we have to fill up the suicide risk assessment every shift for all of them. What to do? How to prevent or how to what? Monitor for suicide. Write it down. Number one, make sure that you remove the shampoo. You know the shampoo, right? Even not in the site. You will work in the nursing home. Okay? So the CNA have a cart. You have to check and what? Instruct the CNA. Please remove all the shampoo in your cart. Because if I, Mrs. Smith, I am like Alzheimer's disease patient, I will grab the shampoo and I will drink. I'm thinking that that is a juice. Okay? So remove the shampoo, lotion, because safety is our priority. So before, of course, we don't have a cassette anymore. You know the why, right? So we don't have that one right now because everything is in the cell phone. And then remove the curtain, of course, curtain in the psych unit, curtain, of course, suicide. And then, of course, the trash can needs to be a paper bag, not a plastic bag, a paper bag. Okay, not a plastic. You know the paper bag, right? So that will be the trash can, not the plastic bag. Okay, paper bag, because they can use the plastic, you know, for suicide. And then usually in the typical psychiatric unit, there's no door in the bathroom, no door. Okay, no door in the bathroom, it's open. And then also in the cabinet, there is no, what do you call that? Like, yeah, it's just like, yeah.
Cupboards.
Cupboard, okay? So there's no cupboard, okay, in the typical psychiatric unit. And then they need to go to the day room for eating. If they will eat inside the room, it should be an order from the doctor. Okay? So, suicide. Now, if the patient have a history of suicide, write it down. This is like a common question in the ATI. Okay? How will you know if they have another plan? Okay? Write it down. So, from depression, they will become cheerful. They will become very happy. Okay? And then they are giving away their belongings. In the NCLEX and ATI example, they are not using like the material belongings. Okay? They are asking the nurse, can you please call my lawyer? Okay, because I need to what? I need to maybe something for the what? Last will and testament, belongings. But again, they are what? ATI and NCLEX are very, very intelligent right now. The what? The example are different. Okay, that's it. End of the study. End of the story. Next, chapter 31 is the anger management. Anger management, again, write it down. This is for who? Bipolar manic patient. Okay? Schizophrenia patient. And also for what? For the antisocial patient. Okay? So, anger management is another what? Group therapy. Again, as a nurse, you cannot facilitate the anger management therapy. If somebody is pushing you to do a therapy, you can report to your director. Why? Because that is not our job. You have to be, certified to do that. Okay, just to let you know, we are nurses. The only therapy that we can do is the medication therapy. That's it. Okay, this is like a miscellaneous. Now, next one, like a miscellaneous. Family and community violence. Again, write it down. For the suspected abuse, what are the types of abuse anyway? What are the types of abuse? Write it down. Okay, because you will work in the long-term care facility. Number 1, physical. IDPH will ask you about that. What are the 7 types of abuse? Physical. Number 2, verbal. Verbal, right? Number 2. Number 3, financial. Number 4, sexual. Okay? And then number 5, neglect. There's a lot, but that is a common. They are telling me 7. 7. 7. Can be number 6 is spiritual. But that is 7. Okay? But anyway, that is the common types of abuse. Now, if you will work in the long-term care, the only thing that we can do is to report to the abuse coordinator. Okay? Who is the abuse coordinator? It should be the administrator, not the social worker. Okay? You have to report. You have to call the abuse coordinator. Okay? Or to the DON in the facility. But in the community, if you're hearing your what? Your neighbor is what? Potential or what? Or suspected abuse, you can call 911. You cannot call 911 in the long-term care facility, my dear. You cannot call 911. Okay? So, another information for the abuse. Write it down. What to do. Okay? So, the only thing that we can what? We can do for the what? For the abused women are what? Do not blame them. Okay, write it down. Do not blame them. Why? Why you cannot go out on the what? On that relationship. Again, the answer, they are in the umbrella of the manipulation. That's why they cannot what? They cannot go out. So do not what? Do not blame them. Why you cannot go out? Why you cannot go out? So all you have to do is be non-judgmental. And then the second one, provide the name of shelter. Oh, that's it? Yeah, shelter. Or you can tell them that if you want, if you are ready, just what? Just prepare a 1 bag. Like what is the movie? What's that? There's a movie about the, the abuse.
Oh, with Jennifer Lopez.
Jennifer.
Enough.
enough. But
Enough. Yeah.
but the movie that described the abuse is the other one.
I don't know.
There's another one, the Julia Roberts. There's another one. Mhm.
Haven't seen it.
Another movie, I forgot the name. But that is the, for me, that is the best description of the abuse. And for Jennifer Lopez, yes, but for me it's like a mild version.
Mhm.
Mild version only. But the good movie is Julia
Sleeping
Roberts.
with the Enemy.
Yeah, Sleeping with
Oh,
the
yeah.
Enemy. If you have a time, please watch that one. It's an old movie, but that is the best description of the abuse and the abuser. Especially, you will what? You will assess the abuser, the husband, that very OC. Simple things. Of course, Julia Roberts drops something, he will get angry right away. Obsessive compulsive. If you have a time, I want you to watch that one. It's Sleeping with the Enemy. Okay? So anyway, I'm done with everything. So let's go to our what? To our psychology again. Okay? Congratulations!
Congratulations.
Oh my God! You see? Yeah, that's it. That's why I'm telling you, it's done. Psych is very easy. Okay? I don't want anybody to be anxious. It's a process. But of course, it is what it is.
Congratulations.
Congratulations, right?
Congratulations.
Yeah, there is
Okay.
like a 400 question practice and ATI.
Yeah, we will do that. Don't
Yeah.
don't think about that. Okay.
No anxiety.
No anxiety.
Yeah.
If you
No,
will be anxious, it's a process, okay? So if you will be anxious, instead of what? Instead of thinking the answer, you know, your system will what? Will cover by GABA. So you cannot think the answer because you are what? You okay, yeah, it's hard.
Yeah.
Right? Yeah. So all you have to do, I don't believe in anxiety or test anxiety because I believe for the word preparation. Okay, are we good? Yes
Yeah.
or no? Okay, so again, we covered this one, the day 1, 2, and 3, right? And then, of course, the substance abuse, the eating disorder, right? Because this is only a miscellaneous, crisis management, anger. So technically, we're done because that is the condensed. The slide 1, 2, 3, 4, 5 is the condensed what? PowerPoint for psych. Okay, next step. On Thursday, exam number 2. Exam number 2, okay, I will make it very, very easy for you. Okay? So, chapter 17. So, day 4. 18. Okay? 26. Like a 26. 19, 27, 28, 29, 30, 31. So, pretty much, please study the day 4, 5, 6, and 7. But usually, write it down. Day 4, 5, 6, and 7. Okay. But usually, my question, write it down. I will ask substance and alcohol abuse. So, by the way, what are the signs and symptoms of withdrawal? Write it down. We didn't cover the signs and symptoms of withdrawal. Okay. Signs and symptoms of withdrawal, number 1, tremors. Tremors. Okay, tremors. Okay, and the number 2, tachycardia. Tachycardia. Number 3, nausea and vomiting. Number 4, headache. Okay, and the number 5, restlessness. So in any withdrawal, that is the answer. Okay, withdrawal signs and symptoms. So I will ask that one. Can you please state what are the signs and symptoms of withdrawal? Okay, and then what is substance and
Miss Mary,
yeah.
Mrs. Mary, after you have headache, then after headache is what?
What's that?
The sign and symptom of withdrawal, headache, and what else?
Okay, one more time. What are the signs and symptoms of withdrawal? Number 1 is tremors. Number 2, tachycardia.
Tachycardia.
Number 3,
Vomiting.
headache.
Yeah, and vomiting.
Number 4, nausea, what's that? Nausea and vomiting. And number 5, restlessness. Okay, please memorize that one. For sure, I will ask that one in your exam number 2. Okay, next one.
Wouldn't they sweat too? Like sweating?
Yeah, diaphoresis. Include diaphoresis. Very good. Diaphoresis. Too much or excessive sweating. Very good. Okay, diaphoresis. Number 6. Very good, Miss Mika. Okay, so that is the withdrawal. Even the Coke. That's why before, even the coffee. If you want to stop your coffee, for example, you're drinking coffee for 30 cups a day.
Ooh.
Okay, it's not good, right? 30 cups. So you cannot stop the 30 cups today. You cannot do that. What will happen? You can maybe the 30 cups next maybe tomorrow just do the 29 cups. And then next day maybe 27 cups until you decrease it. Because if you will stop abruptly, what will happen to you?
Shock.
Withdrawal.
Yeah.
Withdrawal. Even coffee and Coke. Yeah, even with the coffee and Coke. That's why before I didn't stop the Coke abruptly, gradually, until I remove it. Okay? So the Coke, because of what? Coke gives me a diabetes. Okay? So again, in withdrawal, any withdrawal, substance or alcohol abuse, not only on that. So we have to deal with what? With other comorbidity like a liver problem. Liver problem. Okay? Liver problem. Okay, we will deal with that on the lab and clinical. Okay, next. Next one that I will ask is what? The dabda, the grieving. Grieving. Okay? And then of course, I will ask also, of course, the how to deal with the anger management. Again, like a pass-by. But I'm more on, okay, study also the Alzheimer's and dementia. Okay? Alzheimer's and dementia. So, I need to deal this one. The Alzheimer's and dementia. Write it down. So, what is Alzheimer's? Alzheimer's is a form of dementia. Okay, Alzheimer's disease is a form of dementia. So actually, the cause is unknown. They are saying it can be a genetic or it can be something, but until now, you know, it's unknown. We cannot prove that this is the cause of dementia. Okay, next, proceed. How to deal? Okay, what are the signs and symptoms of dementia? Forgetfulness is one of the main signs and symptoms of dementia. Forgetfulness. Okay, forgetfulness. Okay, so are we good? Forgetfulness. And then how to deal with a dementia? Familiar object. Write it down. Familiar object. And do not force the what? The patient. And anyway, in the long-term care facility, right? If Mr. Smith is screaming at you, right? So don't think that the patient is mean. Think, open the chart, maybe the patient has dementia or Alzheimer's disease. Because if they have dementia, they cannot express themselves. The cognition is down. So instead of telling you, you know, they will scream. If the patient is screaming at 4 a.m., maybe they are hungry. So give something, nutrition. Okay? So are we good? So check, do not what? Do not be nice to your patient. Until now, that's a blessing if you are nice to the patient. Okay, so are we good? Yes or no? And aside from
Yes.
that is
Yes.
familiar object. Please mute your mic. Okay, mute your mic, mute your mic. Okay, thank you. So the next one, write it down, familiar object. Mr. Smith, this is your room with a yellow ribbon. Mr. Smith, this is your room with a yellow ribbon. And another concern for Alzheimer's is safety is our priority. Okay, are we good? I will make it very easy, my dear, because the coverage of the 4 and 5, it's not really the main big deal of the site. We're done with the main thing. That's the good news. Okay, now let's go to your assignment. Okay, let's go to this one, the blue. Everybody. So this is like the long way, long method. Okay, long method. Okay, still tomorrow, which is Thursday, still I want you to go over with this one. Okay, I will give you a time to go over with chapter 1 to 31. But there's a technique. Instead of going to 1, I want you to go to 31. To 33 first. 33. Okay? So, deal with what? Maybe this one is 5 minutes only. Okay? It's not really, the main thing.
Challenge.
And then, yeah, go to 32. I'm just telling you what to do. Or 31. And then Esquizo, go over. This is very important. Go to the next chapter.
Oh, yeah.
Okay, until you finish this blue. This is the detailed one. Still, I want you to read. Are you following me? For tomorrow after the exam on your own. Okay, if not, it will reflect in the ATI anyway. It will reflect. You will have a hard time to pass the ATI if you will not go over with that. Okay, are we good? On Monday, write it down. On Monday is the finals, right? The date on Monday is August 10, final exam. So, what are the coverage again? Here we go again. The coverage is this 1 to 5. 1 to 5, the condensed one. Okay? What is the coverage? It's the same. Whatever I ask you for the exam 1 and exam 2, I'll just put like what? I'll just condense it. Okay? To make the story short. Are we good? Yes or no? August 11, we will meet at 5 p.m. 5 p.m. for our clinical. Okay? So now, Saturday, Sunday. Saturday, Sunday assignment. So, Mr. B, I need your help for the ATI.
ATI.
Yeah. Okay. So, share your screen. Saturday and Sunday assignment. Again, be serious. If you want to be in the maternity, or else,
Take 2.
take 2, take 3, or in my Tagalog, E1. What is the English of E1 ka? Okay. E1. Okay, that's why in my day class,
I like that. You gotta
I
write
told
that.
them, one of their students, that E1 ka, E1. Okay? Okay, E1 ka. Okay, so, so again, go to, all right. So, Saturday, Sunday, okay, so legal. I want you to read the unit 1. Write it down. Unit 1. Word for word. Okay, here we go again. But follow it, my dear. I'm telling you. Because the concept of ATI, it's in the ATI book, ebook. So word for word. Chapter 1 to 6. Write it down. So maybe this one will give you like 5 to 7 hours. The unit 1 or less. Or less. Okay? Or less. For Saturday. Sunday. Let's go to the Sunday. Sunday. Actually, what you're doing is you are reviewing in your what? In your finals already. Okay? Okay, next, number 2, Unit 2. Unit 2, go down, Mr. B. Unit 2, again, Unit 2, how many chapter? 7 to 10. Thank
10.
you.
Yeah.
7 to 10. Okay, 7 to 10. So pretty much Saturday, Sunday, I want you to finish the Unit 1 and 2. Let me see the Unit 3. Let me see 3, how many? Oh, and then 4. Let me see the 4. And then 5. Okay. So I need to modify this one. Okay. So again, you need to read the unit. Okay, go up again. Go up again. I don't want to waste a time in okay, it's okay. So again, let's do the Unit 2 first. Let's go to the Unit 2. Skip the Unit 1. Okay, skip the Unit 1 for now. Unit 2 and 3. Okay, skip the Unit 1. I'm so sorry. Okay, because the main bulk of the question is in the Unit 2 and 3. Unit 2, write it down. Chapter 7 to 10. And Unit 3, the psychological disorder, which is the main thing. 11 to what? To 20. So please give your time to the Unit 3. Unit 2 and 3. Okay? Saturday and Sunday. Are you following me? And then we will talk again on Tuesday, and then I'll give you another assignment. Hopefully, we're done next week for reading. Hopefully. Actually, my target area, my target date is what? My target date, you're done in reading next week, Wednesday. Okay, so I need to add more. Okay, hold on. So please add the Unit 1. 1, 2, and 3. I'm sorry. Unit 1 is nothing. 1, 2, and 3. Okay, so can you go down again, Mr. B? Because we need a time to go over with everything. So 4 is okay. Let me see the 5. Let me see the 5. Unit 5. Okay. Okay, which is a light. Okay. Oh, that's fine. So 1, 2, and 3. Okay? Because my target date next week, we are done with the reading Wednesday or Thursday. Because after Wednesday or Thursday, we have to proceed with question. How many questions again, Mr. Alvaro?
For the final for Monday?
No, for the ATI.
Oh, for the 60 questions.
No, for the quizzes and the practice test.
Quizzes.
There's
Yeah.
like 400.
Oh yeah, those are like 400 and something.
Okay, yeah, 400 and something.
Mm-hmm.
Okay, so
Yeah.
pretty much Wednesday, Thursday, Friday, Saturday, Sunday, 5 days of doing the 400 question. You have to send it to me via Schoology. Okay? So, Wednesday. That's why, what is your assignment again for everybody? What is your assignment for the ebook? What is the assignment? 402.
Unit 1, 2, and 3.
Okay, right. 400 is nothing. Because if you will do every day 100, that's nothing. But I need a time, I need a time for you to what? To go over again. 2 to 3 times. 2 to 3 times repetition. So meaning to say, we will repeat again the step. That's the style. Okay? So are you following me, my dear? Okay. So again, Unit 1, 2, and 3. Actually, after this one, you can do the ATI. You can do the reading. You can do August 27, my dear. So what is the date right now? I know it's 20 days, right? But again, this coming Saturday, Sunday, what is the date? It's already what? August what? August, today is 5, 6,
10.
Yeah, 10.
Mhm.
Right? So 17 days. And then after next week, how many days? Oh my God, 10 days until August 27. Okay, it's very fast. So I need to prepare you early. Okay? And then thank you very much, Mr. B. Okay, this is the thing. So next week, can you okay. Next week, this is your Schoology. So everybody needs to have a Schoology. Okay, listen to me, So this is your Schoology, right? Can you see my screen? So
No.
part of your clinical right now to prevent the audit from the what?
Okay.
From the Board of Nursing or from the IDFPR is we need to place everything, all the forms, forms, assessment, SBAR in your resources. So this is your resources. Okay, so all you have to do is what? You add the resources. Write it down. So this is your resource. Add a folder. What do you mean? Why I need to add a folder? Because this is your folder. Of what? Of your ATI and your clinical lab. Why? Because we will not go back up to December 31, 2020 in the normal or in the what? In the American. We will do it, meaning to say you will be graduate in the online world. Okay? Online. Okay? December 31, according to Miss Stephanie. It's not according with me. Okay? So meaning to say, since you are considered undergraduate, usually the undergraduate, we're not doing online. Okay? This is the first time that we are doing because of the COVID-19. Since we are doing, we have to document your what? Activities. So write your name. For example, Alvaro Ortiz, right?
Yes.
Fine. Alvaro, for example, Alvaro Ortiz, Psych ATI. Okay? Just for example. Okay? And then, what color you want, Mr. Alvaro?
Blue.
Okay, blue. There you go. And then you create. All right? Now, you have what? You have your what? Your folder already, Mr. Alvaro. So,
Okay.
all you have to do is just click it. And then, there's add resources. So, add an assignment. Okay? So, all you have to do, what is the assignment? ATI, for example, first 100 question. First 100 question. Right? And then, what to do? Attach. Where is the attach? Attach. Where's the attach here?
Next
The
one,
first one?
that one.
What's
That
that?
one.
Okay,
Yeah, that's the
so this
file.
one.
Mhm.
So you will choose whatever you want here, and then you open, and then you submit. That's it. End of the story. Okay? So are we good? Is that hard? Schoology is easy. Schoology platform is like an elementary. Okay, actually the platform that I'm doing in my review is a little bit complicated. Okay, but the Schoology is like an elementary for me, meaning to say a very basic, platform for me. So are we good, my dear? So submit. That's it. So you have your what? You have your first ATI. So there's a 400. So pretty much you have to put here 400. So 4 ATI. So once we're done with your ATI folder, another one again is what? Go to the resources again. So you will create another folder and we call what? For example, Anna Smith clinical paperwork. Okay? So, in our clinical next week, you will create Anna female pink. Okay? Let's put a pink. Okay? So, this is your clinical file. So, whatever, I will give you an assignment. For example, S bar or whatever, all you have to do, add an assignment, put an S bar. Okay? Or what? Nursing notes. Okay? Or whatever. And then you submit. Okay? Are we good? So everything needs to be documented, my dear. Because if not, I don't know what to do if somebody will what? Will audit your file. Okay? To prove that you are graduate in the online and then you follow the curriculum. Because again, we will go back to the AmeriCare, I think after December 31. Maybe you are considered graduate already, right? Before the December 31, right? Yeah. That's it. So make sure the resources. Okay, any question for now? Okay, so do you want to read today? Do you want to start reading the unit 1?
Yes.
Okay, so I will not hold you too long. Read the unit 1. And then tomorrow, after the quiz, read the unit 2. Okay?
Miss Mary Jane.
Yeah.
The quiz tomorrow is going to be 50 questions.
Yeah.
Like,
Maybe about 30. Maybe I will put this times 2 or whatever because the coverage it's very easy. It's just like a substance abuse. It's just like ADAPTA, the grieving process. So I'll make it very easy.
Eating disorder.
Yeah, the eating disorder. Thank you. Yes.
Sorry.
Can I what?
Can I do mine at 7? Because I have a sleep-deprived EEG tomorrow.
Okay, no problem. Just send me your request. Okay, a message that you are what. So everything will be documented, okay? That you have this one, this is your sleep request or whatever. Okay, like approve. Okay, and then copy also Mrs. Stephanie.
Miss Mary Jane.
Okay.
Miss Mary Jane. So do we have to put our quiz in the resource file?
No. Only in the Schoology. The resource file is only for the ATI. Okay, and also for the clinical.
Okay.
Because as I told you, you will be graduated in online. Okay, in the online virtual classes. So we have to make sure in the undergraduate, it's a little bit, we are concerned, me and Mrs. Stephanie, if they audit you. Okay? So maybe they will ask, where is Miss Micaela's file? What is the proof? That's why I told you, you have to send always in the Schoology, not in my personal email. Because personal email, like my Gmail right now, one of my Gmail is what? It's not functioning because it's what? It's a lot. You know? It's a lot of file. And I can't receive right now any messages from that Gmail already. Okay? So, but in the Schoology, this is like the platform from the school. And of course, there's an IT behind the Schoology. It's a platform. Okay? So are we good, my dear? Yes or no?
Yes.
Yeah. So this is the resources. So next week, I will tell you, please post your ATI, the first 100. Please post the second 100. Please post the third 100 and the fourth 100. Okay? But for now, I will not hold you too long because I want you to read the unit 1 first. 1. And then tomorrow, after the what? After the test, what to do? Read the unit 2. Okay? Friday, if you're not doing anything, read the unit 3. Saturday, Sunday, if you want, proceed. Okay? Go ahead. You know, you can read the 4, 5. Be what? If you are a wise student, read. Okay? Be on the top of it. So that during the test, you memorize everything. Okay? Are we good? Okay, Miss Teresa, is the question is inside the ATI ebook? Yes or no?
Yeah, it's the same. It's got a little bit more detail in the ebook.
Oh, yeah, but about the actual exam in the ATI.
What is the question you're asking me?
So I'm asking that is the question, the actual question is coming from the ATI resources, right?
Yes.
It's in there, but all you have to do is you have to read it, right?
Yes.
Okay, thank you. Okay, so anyway,
Miss Mary
yeah, go ahead.
What we are posting on the resources, is it when we read, then we solve the question, and then we post the answer to the question on the resources? Is that what we're doing?
No. Okay, so okay, tomorrow, right? Same old style. You will receive a message from me, just like we are doing before. Okay, we are doing before. You will receive. It says Psych Exam 2, and same old story. You will reply to me. In the resources, what is the purpose of resources, Mr. B? To keep the records. Why? Because you will be graduate on what particular? In online. Since you are undergraduate, okay, we are concerned. If somebody audit the AmeriCare, they will what? I mean, in anonymous, they will what? For example, this is the style of the, coming from the Board of Nursing. This is the style. Can I see the graduate from the graduate? Okay, graduate from September or December. Okay, and then I have a list. Okay, so I'm the inspector. Okay, in anonymous, I don't know, in a random order. Can I see the file of Teresa Velez, please? And also the file of Laika Angelica Dolubino. Also the file of Mr. B. And also the file of this. Yeah, that is the style. I've been in, in a very top, like an ABHES, or in a very top, from coming from the state. So, and then another one, can I see the file of the transcript? Okay. And then can I see can I see the file of the, what you call this? Your pretest. They will scrutinize everything. Can I see the grade? Okay, it's in the Schoology. So can you pull up? Can you please pull up? And then they will talk to Mrs. Stephanie. That is the style in a random order. So now, if you don't have a file, I don't know what to do. So we will go to resources and then you don't have any file. Oh, I don't know what to do. Maybe they will ask you to go back. It will be a what? It will be a red flag. Red flag to the school and red flag to you. Okay? So are we good? So the resources, my dear, do not combine in your mind that the resources is the test. The test is in the message in the Schoology. The resources is to keep tracking your records, because as I told you, you will be graduate in online. Are you following me? Yes or no? Do not combine that the resources is what? Is the test. Okay? So the resources is what? Is the ATI and also for your clinical paperwork. What is the clinical paperwork? Don't worry about that. I'm the one who will tell you SBAR, nursing notes, assessment. Just put on there. That's it. Okay? So any question? Hold on. So this is the example. Example medication template. So you have to, this one, you have to what? You have to do the medication template. This is only an example, okay? So another one, clinical system disorder. Example, I want you to do the care plan of what? Care plan of schizophrenia. So you have to fill up this one. Okay, this is only an example. And then example assessment form. I want you to do the mental or the assessment for what? For the patient. So you have to fill up this one. And what to do? All you have to do is you have to what? Medication template. You go to resources, go to your folder, and add an assignment. And all you have to do, just put the name. So medication assignment or template or whatever. Okay, medication template. It's very easy, my dear. And then attach, right, the file, and then you submit. Okay, so are we good? Is that hard, my dear?
No.
Are you sure?
Yeah.
Okay,
We're good.
Miss. Okay. Any question for now? Okay,
No.
Mr. Emmanuel. Any question?
Not right now.
Okay, Miss Teresa.
No questions, thank you.
Okay, Mr. James.
Yes.
Question?
No.
Okay, don't forget Unit 1 today. Okay. So Laika, Miss Laika.
Yes, I'm good.
You're good, Mr. B. Okay, Shiri.